time to continue. Welcome back, everyone. We will now have a second roundtable focusing more on the role of GPOs and in public procurement of innovation. Olman will also again moderate the discussion of this table. So we will have two other partners of the RaDAR consortium, Bérénice Cleuet from Resah and Jordi Jordà for Consorci de Salut i Social de Catalunya. So Olman, I give the floor to you for further introductions. Thanks.
Thank you so much, Maria. And let me share my screen once again. Here we go. So, can you see my screen? Yeah, right? Okay. So as Maria mentioned, this second table, we have GPOs, central purchasing bodies in PPIs, and we have the privilege to have two central purchasing bodies, one from France, which is Resah, as a buyer, who also had a leading work package that helped with their experience in procurement, the rest of the buyers, and the procurement preparation. And we have Jordi Jordà from Consorci Sanitario de Catalunya, who came with also with Laboratorio de Referencia and Hospital del Mar as a supporting entity, and we will talk with them a little bit. So Bérénice and Jordi, welcome, and thank you for joining us. Are you guys here? Yep.
Yes. Hi. Hi.
Hi, Bérénice. Thank you. And Jordi as well?
Yes.
Great. So what we will do first is also just a little bit like before, we will a couple of slides to introduce in the case of Bérénice the Resah case as a buyer and what this role sort of represents, and then we will have Jordi introduce Consorci and GPOs in PPIs. So Bérénice, we will pass the slide.
So thanks, Olman. Thanks for all being here, and thanks, AQuAS, for the insightful stakeholder meeting. I'm Bérénice Cleuet, European Project Manager at Resah, which is the French central purchasing body and a key player in the French public health sector. And we're supporting and providing over 4,200 affiliate hospital, healthcare and social welfare facilities, and as well regional authorities. And we also offer tailored procurement solution which cover all needs of our beneficiary across the wide range of 12 categories, from medicine through medical devices to intellectual properties and consulting. It's a short introduction to then jump into the RaDAR project, because within the RaDAR project, we have a dual role. On the one hand, as a work package leader, we have a responsibility for coordinating the implementation of work package 3. So helping to draft the various call for tenders of the different buyers. For this, we provided methodological support and tools, and share with the buyers purchasing practices to guide them in their drafting their own tenders. And as a leader of the work package, we prepare follow-up report for the European Commission. On the other side, so next slide, please. So on the other side, we are also buyers on the one of the two buyers group, and our market is composed of 9 lots, divided into 3 thematics, so rapid test, equipment, and IT solution, and so with 8 individual lots and 1 global lot in order to cover all hospital needs. And thanks to the RaDAR project and the procurement budget elaborated at the beginning of the project and its linkage to the EU subsidies, we are able to apply the wholesaler model for a specific part of our market. So for 3 lots, so the IT lots and the solution dosocos and antibiotics, we act for this 3 lot at the recipient of the EU subsidies, and because we first purchase the solution from the supplier, so from Nosotech, and then offers this solution to interested healthcare providers at a discount rate. So it's quite a good opportunity for us to disseminate through our beneficiaries innovative solutions applied to a specific thematic. So here, antimicrobial resistance.
Great, thank you. Jordi, please introduce you.
Okay,
and
quick introduction. So, Consorci de Salut i Social de Catalunya is a GPO. So we act as a central purchasing organization, but not only that. Okay, we are an association, so we represent and we provide services to all our associates. Just to put some numbers, we represent and we provide services to 43 hospitals, 60 primary care settings, mental health, intermediate care, and as well laboratories like Laboratori de Referència de Catalunya. Okay, so one of our services is to act as a GPO for all our associates, but we also include innovation services, sustainability services. We do represent our associates in front of the local authorities. And myself, I'm Jordi Jordà, and I'm the Director of Innovation in my organization.
Great. Thank you. And you want to introduce this part as well?
Yeah, so, Bérénice said they had 2 different roles. So in case of Consorci, we only had one objective, and it was to help Laboratori de Referència de Catalunya and Hospital del Mar to buy what they needed. Okay, so that's what we try to represent. The 3 institutions, we work together on the tender process, but then Laboratori and Hospital del Mar are the ones executing the contracts, and then we help them again with the monitoring phase of the contracts.
Great, thank you. So now I'll stop sharing so we can see ourselves better. So this is super interesting because we have 2 purchasing bodies, which they have showed us that they have also different roles within their institution. There are also similarities and differences among them. Sorry. Resah is enabling the French market with this updated set of services and contracts, and Consorci has shown us that they can help and support these member organizations, but that they have other members that could also in the future benefit, or so on. So the first thing I would like to address is, how about the value-based procurement element that is introduced in RaDAR-PPI? How was that something for your GPO experience? And Bérénice, could you give me a little insight, and then Jordi?
Yes, RaDAR, it's actually it was our first really experience in this area, so in a value-based procurement. So a first big jump into this quite interesting procurement practices. But in order to start implement this kind of procurement practices, we are initially implementing specific clauses in the tender document, so in the first phase of public procurement, in order to monitor the impact of the solution without introducing a bonus penalty mechanism. Because we would like to prefer to set up a voluntary 3-party dialogue and define the indicator directly with the end users. We are interested to collaborate with us in this value-based procurement in a specific area in AMR.
Yeah, and so adding to that, on the value-based procurement, so we are asking our hospitals and laboratory de referencia to shift the antimicrobial resistance approach from a retrospective way to a prospective, right? So now in 8 hours, they can do this. They are doing a shift to treat this antimicrobial resistance approach. So in the process of buying, we also had to change and shift the approach. We couldn't just focus on, okay, we focus on the tender and then the paying system and just putting all we need, because this is innovation and we don't know how we'll act afterwards. So we also need to focus on the monitoring. We also need to focus on adding the company into the contract and into the execution phase, and then monitor altogether the execution.
Yeah, I'm actually, Jordi, I'm quite agree with you. But us in practice, we encountered some difficulties in monitoring these indicators due to the limited time and human resources within the healthcare facilities. And it's something that I would like to point out, that it's really complicated at the GPO to monitor this kind of indicators directly. But we take some from this difficulty myth, because we would like to, at the end of our market, so in 2 years, we would like to do a market assessment in order to take the good practices and fix the difficulty myth encountered, in order to relaunch in a quite ameliorative way our market. So
yeah, I mean, it's true that it's difficult to monitor, like the monitoring phase, and then payment by results will be a difficult part of the project. I mean, we started already doing this payment by logistics, which is an approximation to payment by results. Like if we need some products to arrive at the right time, so we try to modulate the tenders to pay based on that, which, because this is easier to monitor. Like, okay, when did the product arrive? In the morning? Okay, I needed it yesterday, so I pay you 30% less. That's easy to apply. Then we need to translate this also into the execution phase. And so if I expect with your product, or you say that your product can reduce the antimicrobial sequencing for 3 hours, and then in the reality, with all the changes that we implement in the hospital, it's just 5, then we need to talk about the expectations that we had and then the results that we get.
I think you guys are touching some very interesting elements, because at the end, if we are able to go towards this outcome-based approach, and if you are able to connect with those needs that your, let's say, the final user, it's actually, they're paying, then your contracts, your frameworks become of interest, not just because they are procuring a service or a specific product, but because it also maybe allows them to drive a little bit that transformation, right? In your case, Resah, you didn't know who was going to be that end user, but on the other hand, you're enabling the entire French-speaking market to have these solutions within the framework of something that will live on for sure after the project. So what sort of learnings has this RaDAR-PPI been introduced within the Resah normal day-to-day, let's say, processes and stuff? What can you tell us about this?
I would like to say maybe first 2 things. The first one, it's allow us, so the RaDAR-PPI project allow us to highlight the fact that it's important for this kind of project, so an European project and a PPI European project, to establish at the beginning of the project a strong internal multidisciplinary team composed of complementary profiles. So it means that including at the same time procurement specialists and also technician expert. For the RaDAR-PPI, for the RaDAR project and for the PPI, we are helped by Limoges University Hospital and INSERM for the definition of our needs. So it was very useful for us. So it's something that we would like to duplicate for other PPI projects. And apart from I would say the procurement and the technical experts, it's important to have also a strong coordination made by a project management team like us inside the international department of Resah, because this team will be responsible for disseminating key information across the group. So meaning the multidisciplinary team, but at the same time also the consortium, and facilitate the dissemination of information for the European Commission, for our direction at Resah, and also promote the open benefits from a national point of view, and also disseminate key information about the objective of the project, of the PPI, the constraint, and also the key consideration. It's my first point. So establish a strong internal team, and also and when the consortium joined the consortium, we thought that it's something great to have another GPO which allow us to create added value, because we can promote some similarities as we are doing now, and also enabling the sharing good practices, because we have the same scope. So procurement is our key activity. So it's quite nice to promote best practices between European GPOs, and allowing us also to doing some comparison between the organization, because even if we have the same scope, so procurement for other organization, we don't have the same geographical scope. So it's quite interesting to share practices in this.
Yeah, totally agree. Sharing practices. Can I add my learnings, Olman? Sorry.
Of course, please do so.
Yeah, so it was sharing practices, but as Bérénice said, it was like us coming, we were the ones coming the latest. So I remember that when we came into the project, AQuAS, ECO, everyone was saying, okay, we need to do this like really, really quick. We need to be as quick as possible. We need to accelerate the process. You can learn from all the experiences already done on the PPI. So we looked into the tenders already published that allowed us as a GPO to start working on the contracts themselves, but we did it in parallel with the excellent work, I would say, done with the Laboratorio de Referencia de Cataluña, Buenaventura, Eduardo, and Hospital del Mar, with Mila and all the people working there, because we were working in parallel. They were defining the need, and we were defining the contracts and the tender process. So that's a learning that we get from this project, is that we can actually be quick if we want. We just need to work differently.
Amazing, Jordi. And I think this is a great point to stress, and a big thanks to actually Consorci, Laboratori, and Hospital del Mar, because you actually showed the scalability of the value that doing a value-based procurement documentation, let's say, and all that preparation in aligning the need and all that consensus was already tested in your case to enable a fast-track version for how someone with the same need or a similar need can adapt to the local context, because AMR is always local, but that this collaborative work among different institutions, you are actually showing us how that pace enabled results that are now part of the RaDAR project. And we're so proud and privileged to have all of you here. And with that, I would think we have this table come to an end. Thank you, both of you, Bérénice and Jordi. It's been a pleasure talking to you, and I send back the floor to Maria.
Thanks, Olman, and thank you, Jordi and Bérénice. It was a very interesting explanations to see also the insights from the GPO perspective. So well done.